So I'm going to jump right in here. Deep Griha has been around for, gosh, 49 years now. It is hard to imagine. And really, it's been a remarkably successful organization. So tell me a little bit about what you think kind of your key ingredient to success has been. What's been the core there that's made such a difference?
I think for Deep Griha, and this is something that keeps coming back to me afresh, especially in the last few years. One of the things what's kept us going through all these years has been the ability to change, keep up with the changing times, not just the environment, but basically listening to the community and adapting our programs, reinventing our programs, redesigning our programs based on what the community needed. And as you can imagine, we've been with the community, some of the communities for over 40, 45 years. And there has been growth in the community as well. And because of this ability to keep on changing and adapting, we've been able to grow with the community and make sure that the new needs or the changing needs are met with the programs or interventions that we take on.
Makes such a difference. And, a lot of your staff comes from that community, right?
Absolutely, more than 50% of our staff comes from the community, and they're, I think, one of our biggest strengths, for sure.
You've got community health workers that are there as well, and so there's no barrier between you and the community. You're all one with that. You really are. I love how it works together. You're working with the community, not for the community per se. You're partners.
Exactly.
So for those that don't know it, give me the really brief founding story for Deep Griha.
I'm going to try and make sure that the brief part of it stays. So the founding story of Deep Griha, for those who don't know, it started in 1975 with a one-room clinic. Our founding director being a doctor, that was the first step that she could easily take. And everything that we have today is a result of listening to the patients who came in. I think it was quite unusual for a lady doctor in the 70s, for the community to have access to a lady doctor in the 70s. So I think they came up with and spoke a lot more with her. And that information, the input that she was getting, helped her to decide what the next step should be. So for example, the clinic identified malnourishment or malnutrition as an underlying factor for a lot of health issues. And of course, that led slowly but steadily to this nutrition program. So that's just a small example of how Deep Griha has consistently listened to what the community needs and responded with interventions that meet that need or support that need in some way.
Absolutely. So now it's grown from that one-room clinic to this organization that does a host of things. I mean, you all are doing education and youth development and skill building and income generation, women's empowerment and safe housing for children. And there's a host of things that you have grown. I don't know how many staff you have now, but it's up to
80.
What? 80. Okay.
Staff. Yeah.
Wow.
Yeah.
So you referenced at the beginning earlier with change, things like the pandemic. And I've got that had to have thrown a loop into things I just only can imagine. But I think we also know that disruption can be an opportunity to kind of make us look at things differently. So tell me a little bit about what that experience was like for you and what's new that's emerged.
So I think the disruption also led us to refocusing on areas that we hadn't looked at. It helped us to say yes to opportunities that we may or may not have said yes to in pre-pandemic. Because, we had a whole host of programs, but the disruption changed that. We had to sort of relook at some of the programs and step back from some of the interventions that we were undertaking, and then we're in a space to say yes to a new opportunity that came to us. Through the years, I mean, if from the one-room clinic, we've worked with children. That's been our focus. Women and children has been the focus through all the programs that we run. We worked with senior citizens as an sort of side effect. So like, with the sponsorship program where children who came from single parent homes or had been orphaned. Uh, Grandmothers, grandparents were part of the program because they were the caretakers for the child when we were supporting them, as we continue to support them. But in the last few years, we had an opportunity through a collaboration to work with senior citizens specifically. So sort of, the first time that we were working with that age group, with education being a part of it, and healthcare was an aspect that we looked at very deeply. So again, we did work with senior citizens, but not in the focused way that we are now. We started off in 2020, and I think since April 2023, we have had over 4,000 individuals registered with us. Um, and we are following up with them on access to government schemes, making sure documentation that they need is in place. Those are the basics. And then, of course, access to healthcare, health checkups, health camps. And beyond that, what again, as like we keep learning, this interaction obviously led to conversations, and that those conversations led to learning. And we started a meal program because it was something that some people needed. And in that, when they used to come like half an hour before or 1 hour before before lunch was ready, just to hang out, to spend time together. And that led to a drop-in center where we have various activities, like we have yoga planned for them, we have a dance or movement class planned for them, just different interventions. So recently, when we had some volunteers from Sangam, the Girl Guide group, they used to come and work with our creches. So they used to do a lot of children's activities. And when they came and it was like, oh, it's senior citizens you're working with now, they could just use those same activities. And our ajis and azubas, like we call them, had a blast just doing craft, drawing, things that they probably didn't have a chance or an opportunity to do when they were younger. So it's been quite fulfilling to see that this section or this age group that we want specifically working with, and the way that program is going and what that interaction is leading to has been quite rewarding for us.
Yeah. It's so interesting as a public health physician. I really appreciate that intersection between physical health, mental health, and social connectedness, because it's really what helps us all keep growing through a lifespan,
Mm-hmm.
and it makes such a difference. And I'm guessing you've probably mixed some of the generations in some of that activities too. So have the
Oh,
kids done
yes.
stuff with the Ajis yeah, what's happened
Absolutely.
there?
Yep. So I think a few months ago, we had a group of Ajis and Azobas travel to City of Child, and we had Deep Griha Academy students come to City of Child. And these three different interventions came together and spent time together. And it was beautiful because the children had really prepared. So they had games prepared for the seniors. They had a huge welcome where they had the music and the drums, and they welcomed them into City of Child, and everyone got a flower. And the DG, Deep Griha Academy children brought a small handmade gift to give them. They had questions prepared on, like, to sort of have a conversation and to learn a little bit more about the lives of the Ajis and Azobas that were visiting. And it was just wonderful to see these three interventions come together in that way, and add value to each other's lives and just being. So and we hope to do a lot more of that.
Like a great day. Sounds wonderful. It sounds wonderful. You described there how I think, people grow through intentional connection. But it seems like organizations can grow through cross-sector and even like trans or international partnerships, as we've seen. And so I've been hearing recently about a new project you've got with Cornell Medical School. What's going on with that?
Um, so I think I'm going to step back a little bit to how Deep Griha functioned all these years. Was pretty much put your head down, do the good work, and that was enough. But like I said, the environment is changing. How we raise funds is changing. So of course, how we document things, how we report things, everything is changing. And you need to have proof. And what better way to have proof than to have a foundation of a research study? So one of our ex-volunteers who sort of visited, and she was working with other hospitals through with Cornell and through other hospitals in Pune, and she came visited Deep Griha. I think, like I said before, that the field workers or the community health workers that we work with have been our strength, and the study that we're working on looks at how community health workers conducting home screenings for gestational and postpartum diabetes can change how women look after their health if with early identification or early diagnosis. So it works, it builds on a strength that Deep Griha already has, but also brings in learnings when it comes to uh, which we are going to be using for program design, where it's like, how do you record things? How do you document things? How do you measure something? And we're really looking forward to the learnings that will come with the program. Also, it takes Deep Griha from its current uh, 5 communities that we are working in. We're going to be working in 12 totally, so about 7 new communities. So that's quite an exciting space to be, because with Deep Griha starting, we moved into 3 urban communities and have been working in the same 3 urban communities for a very long time. In the last few years, we've added small pockets of communities that we've moved into. So this sort of gives us a wider reach, as it were, and more to listen to, more to hear from the community, and obviously sort of figure out how we would like to move forward with it, with this new learning.
So, one last question, and this one's a little bit more personal. I really think of Deep Griha as an organization that really transforms lives, whether it's the individuals or the communities or the staff or the volunteers. So tell us a little bit about how being part of Deep Griha over these many years, and now leading it really for several years, has changed you. What's made a difference for you?
Um, so although I've been a part of Deep Griha for way longer, I think the first time I really truly experienced Deep Griha was when I was 19. And I had started, while I was at college, I had started working at Deep Griha. The director thought it might be a good idea for me to use my commerce studies practically in the accounts office. But I think in those initial years, I spent very little time in the accounts office. I was an assistant anyway, so uh, most of my time was spent with field workers out in the community, doing home visits, or in the nutrition center, getting to know the children who came in for special nutrition, or in the creche, just spending time with the children who had come in there, or in the clinic, just it was everywhere but the office. And it was an absolutely incredible experience. So somebody who was part of Deep Griha in such a deep way, I saw so many things for the first time as a 19-year-old. Things that, I had been surrounded by these lives, but I had never seen them. I think that was one of the most rewarding times of my life in many ways. I was getting to know people in a very different way. It was an incredible experience as a 19-year-old to be able to see this. I'm grateful that I was able to see it. Slightly ashamed that it took me that long, but grateful all the same. There was so much learning at that time. Also, I think, and transformation-wise, I was very adamant once I was finished with that stint that I didn't want to work at Deep Griha for many reasons. I felt like there was too much family. Um, but I could do no other job for longer than 8 months. I think that became my thing, because the kind of contentment and the job satisfaction and just the privilege of doing the work that we do at Deep Griha was such a pull that I didn't last anywhere else or in any other jobs for long enough. And I think even when I came back for the school project in 2007, I came in for 1 year. I said I will do it for 1 year and I will plan the project. And here I am. I have no idea how many years later. Um, still drawn to and still inspired by the work that we do, still inspired that the work people that I work with, most definitely, especially the people who work in the field, because it's just a different level of commitment. It's a different level of um, the responsibility. I think I've asked some of our field staff, why would you work? Why did you choose to work at Deep Griha? Because it's the pride that they feel about the work that they're doing for their own community. And I think, of course, you're going to be inspired by people who are choosing to do that every single day. Um, the participants, I mean, these days I go into work and I have all the ajis and our azobas were sitting outside in the sun, like sending me flying kisses and greeting me with so joyfully, and they're just sitting around. I think they just like to come to the center and just hang around. So I think the participants, the work that we do, all of that has changed how I see the world. I think, and who I am and how I how I present myself to this world and to society today. A lot of it is Deep Griha. Even small things like the volunteers being such a big part of my life. I was a very shy child, and all these interactions with people from across the world, I was traveling without moving. I was exposed to the world without actually moving from Pune. And I think um, I am, again, very grateful for that. It came with its own different set of learning
It
and
does.
growing differently.
It does. And I think you gave me that gift as well. And so I think you have so nicely captured how Deep Griha and the experiences there have really opened your eyes and your heart and your hands. And it's done that
Mhm.
for folks across those communities and across the world. So it's
Mhm.
just so exciting to see that work in action. So, Ashlesha, this has been a joy to have this conversation, really has. And you have shared so well, such great examples, I think, of how it's the fact that in staying true to sort of that why and that how that you do things at Deep
Mhm.
Griha, that's made the what that you do so relevant, so effective today. So we so appreciate all that you and the staff do there. And it really is our honor to be a part of that and to invite others to join in.